Tonight, coronavirus cases over 2 million worldwide. In the U.S., the death toll now topping 32,000. Some states reporting their deadliest days yet, and the battle over reopening America. Tensions boiling over as protesters slam Michigan's stay-at-home order. Also concerns about where your food comes from. The CDC at a South Dakota pork processing plant, over 500 workers testing positive. The governor resisting ordering a state lockdown. The crisis at the nation's nursing homes, 5,500 residents dead. Some families left in the dark when their loved ones are infected. Some states keeping their number of nursing home cases secret. The alarming news on the government's emergency relief program for small businesses. Is it just hours from running out of money? The incredible moment, a father who was in a coma battling the virus, seeing his family for the first time in a week.
We love you, we've been praying for you, and we can't wait to see you.
What his wife found that may have saved his life. And will it be the new normal? Restaurants taking your temperature, sports with no crowds. How life as we know it could change.
This is NBC Nightly News with Lester Holt.
Good evening. As the number of COVID deaths has surged to at least 32,000 in this country, that drumbeat to reopen the economy is landing with a dull thud in regions still seeing their deadliest days. Daily deaths in New York still routinely hovering above 700, and where there is not enough testing capacity to safely ease restrictions. All as a new crisis grows around the country, hunger. Our correspondents have it all covered. First, Gabe Gutierrez.
Tonight, the calls to reopen parts of the nation's economy are growing louder. Protesters at the Michigan state capitol blasted the governor's strict stay-at-home order, which, among other things, even restricts interstate travel.
Putting all of these workers out of business it's a disaster.
President Trump is now suggesting some states might start reopening before May 1st.
We have beautiful pieces, beautiful states with capable governors. They know when it's time to open.
But in the Northeast, the crisis is far from over. COVID-19 took another 752 lives in New York State, and those are only the confirmed cases. Still, ICU admissions and intubations are down again.
We have the infection spread down to a manageable number. We've accomplished that.
To keep stopping that spread, today Governor Andrew Cuomo ordered all New Yorkers to wear face coverings in public if people can't maintain proper social distancing. The mayor here has just appointed a food czar and is setting aside $170 million for emergency meals over the next few months for those most in need. Today in Austin, Texas, hundreds of cars lined up for free meals at this food bank. This week, other states such as Louisiana and Florida have had their deadliest days. The husband of this nurse in Miami believes she died from coronavirus.
My wife would still be here right now if she was given the proper protective equipment.
It's so hard.
Michael Merritt is an ER nurse in New York whose patient died within an hour of getting to the hospital.
I FaceTimed the family while the man was dying so they could be with him.
He has this message for those who want the country to reopen.
I'm sorry for people that's suffering from unemployment, but I'm seeing so much pain and sadness and sickness every single day. I don't understand why they would even consider it. Not until we're in the clear.
Tonight, New York is sending unused ventilators to Michigan and Maryland, ammunition for the next battles in the ongoing war. Gabe Gutierrez, NBC News, New York.
I'm Blaine Alexander in Sioux Falls, South Dakota, where some residents are desperate for an order to stay at home.
They want to keep their family safe. They want to keep their community safe.
South Dakota is among only a handful of states with no statewide mandate to shelter in place, despite the fact that COVID-19 cases here have nearly tripled in just 1 week, more than half traced to this one plant, the Smithfield Foods pork processing facility. Governor Kristi Noem says a statewide order would not have stopped the virus because the plant is an essential business.
This plant is incredibly important to our food supply in this country.
A CDC team arrived today with more than 500 employees at the processing plant having tested positive.
You'd see very crowded departments, very crowded floors. You'd see narrow hallways, narrow staircases.
Now, the plant that supplies 5% of our nation's entire pork supply is closed indefinitely. And today, Smithfield announced 2 more closures, joining other companies taking similar measures.
How different is it going to look when we go to the grocery store 1 week, 2 weeks from now?
I think you're going to see the signs, that say, you can only buy 1 pack of pork chops today.
Smithfield says it's taking new precautions to prevent future COVID-19 cases, but officials fear without an order to stay at home, the virus will devastate this small town.
Without that order, some people just don't get it.
Blaine Alexander, NBC News, Sioux Falls, South Dakota.
And for families of people in nursing homes, this crisis is heartbreaking. The virus is exploding in these facilities, hitting more than 3,300 of them nationwide, killing well over 5,000 people, and their families say too often they're left in the dark. Here's Kate Snow.
Hi, I was wondering if I could speak to one of the nurses.
This morning, Annette Jansen was again calling the nursing facility where her mother, Leona Behrens, lives.
Sometimes I can get through, sometimes I can't.
2 weeks ago, her mom could wave from inside.
So I would call every day, and I kept getting the same thing. She's fine, she's doing great.
But last week, she says, she walked up to the window and was shocked.
I see her lying in bed with the oxygen in her mouth.
That's how you knew she was in trouble?
Yes.
Seeing an oxygen tube?
Correct.
She says a nurse said her mother had been tested for COVID-19. The facility says it informed Leona's husband when the test later came back positive, but were not obligated to tell Annette since she is not her mother's primary guardian.
That's the hardest part, is not being there for her, not being able to touch her and hold her and just let her know we're there.
Many states, including Florida, are not requiring nursing facilities to report to their departments of health when there are cases of COVID. Only 17 states provided NBC News with the names of facilities that have infections. And privacy laws constrain communications from nursing homes.
You're required to tell the family members if that family member has COVID-19. You're not required to tell another person living in that facility that somebody has the virus.
So if someone down the hall has it, you may not find out.
Exactly.
I heard you got a test yesterday. Do you remember?
Yes, I got the test, but I don't know what it was.
Andreas Vagdis Gumbrell's father has dementia, heart problems, and COPD. He was moved from his original facility to another to make way for COVID patients.
I worry every minute and every second of the day because of the move.
But we love you very much.
If he contracts the virus, she fears she'll never see him again. A fear for far too many families right now. Kate Snow, NBC News.
Yeah, let's turn to the financial disaster of all this now. In word tonight, the $350 billion loan program for small businesses could run out of money within hours. So what's next? Peter Alexander reports.
With a pair of locations across New York, Other Half Brewing just got a huge boost. A government-guaranteed loan to help pay its rent and staff after David Berman had to furlough 24 employees due to the pandemic.
It was a lifeline for our business at a time when we had to drastically change our business model.
In less than 2 weeks, more than $305 billion in emergency loans have been approved to more than 1.4 million small businesses nationwide. With applications for the first-come, first-served loans pouring in, multiple sources say the $350 billion fund could run out of money as early as tonight. Why the demand?
Mark Cuban calls this free money. The Paycheck Protection Program means if your business keeps full employment, you don't have to pay the loan back.
Both Democrats and Republicans want to add $250 billion to the emergency aid fund. But Democrats want money for other programs, too. Also tonight, a new controversy over those paper checks for millions of taxpayers who do not have direct deposit on file with the IRS. President Trump's name will be printed on the front of those checks, according to the Treasury Department. The first time that's ever happened on an IRS payment. House Speaker Nancy Pelosi tonight blasting the move as shameful. The Treasury Department denying reports that adding the president's name will delay the checks, saying they're scheduled to go out on time and exactly as planned. Peter Alexander, NBC News, the White House.
Now to the controversy over President Trump's decision to cut off funding for the World Health Organization and new questions tonight about China. Did authorities there withhold critical information about the virus? Here's Richard Engel.
Tonight, the World Health Organization pushed back after President Trump suspended U.S. funding.
We regret the decision of the President of the United States.
The condemnation was far stronger from nearly every major public health institute tracking the pandemic. Bill Gates calling it as dangerous as it sounds. But President Trump blasted the WHO for initially opposing travel bans and pushing, quote, China's misinformation about the virus.
It would have been so easy to be truthful. And so much death has been caused by their mistakes.
Do you believe that the WHO, as President Trump strongly suggests, is in China's pocket?
No, I don't believe that. They are UN diplomats, and they are very reluctant to criticize countries because they know they need to get the information.
And tonight, the Associated Press reports government memos show Chinese authorities secretly determined they were likely facing a pandemic on January 14th, but kept silent for 6 days. In that time, allowing massive New Year's celebrations. Chinese officials deny a cover-up. Meanwhile, Italy and Spain are starting to ease out of lockdown, reopening some stores. And if they can do it safely, maybe other nations can open up too. Richard Engel, NBC News, London.
And tonight in this country, just over 3 million people have been tested for the virus. That's a tiny fraction of the population, but there may be signs of progress in this critical step to restarting the economy. Here's Tom Costello with that.
In Edison, New Jersey, long lines for a drive-through coronavirus test. Spitting into a test vial rather than a nose swab. Rutgers University says it's safer for medical professionals and more accurate. NBC's Ron Allen learned results come in 24 to 48 hours.
This is really a game changer.
Another game changer at Emory University Hospital in Atlanta, rolling out its own test for patients and staff to determine if someone has coronavirus antibodies, indicating they've had the virus, recovered, and hopefully have immunity.
I don't think I've had COVID-19, but I am kind of trying to see how this test is going to work.
Among the first to get tested, Associate Chief Medical Officer Dr. Colleen Kraft. But when the results came back, a shock. Despite never having been sick, Dr. Kraft has the COVID antibodies.
I was a little surprised, partly because of my careful attention to infection prevention at work. But then I also was happy that if I've had it and I've recovered from it, then at least I know that.
The original antibodies to do the testing came from an unlikely pair of 80-year-old donors.
We were the poster children for the people that are supposed to succumb to COVID-19, but we never did, and we don't know why.
Renee and Clyde Smith were quarantined on the Diamond Princess cruise ship with their grandkids in February after hundreds became sick. They never did, but still tested positive for the virus. On Tuesday, Emory began using their antibodies to start testing the medical staff.
Having Clyde and Renee's blood was very important to be able to develop the blood test.
Meanwhile, in many low-income neighborhoods, an army of public health workers is now going door-to-door contact tracing.
We go out to various places that most people in public health don't want to go out to.
Tracking a virus that knows no boundaries. Tom Costello, NBC News, Washington.
And so much we are still learning about it tonight. We're back in 60 seconds with an amazing turnaround tonight for a man severely ill with the virus, in a coma, on life support. And wait till you see him now, how what his wife found may have saved his life. On the front lines tonight, the heroes racing to save lives even before patients get to the hospital. Here's Stephanie Gosk.
Behind every wailing siren, an EMS team rushing to save a life.
Working in the city of New Orleans as a first responder is probably one of the toughest things me and my colleagues are doing right now in our lives.
This Sunday I did 12 cardiac arrests and a 16-hour tour.
For this particular disaster, there's no appreciable end in sight. When's it going to end? When's it going to be over?
In the last several weeks, these emergency responders, used to trauma, used to danger, admit there's no way to get used to this.
I have to sit there and explain to them that, they need to say what they have to say to their family member, because I don't know if this patient is going to come back from the hospital.
You're waking up and knowing that you're coming to work to deal with death all day.
172/96.
Rich Straub is a paramedic in Westchester, New York, where they have been battling COVID cases since February.
This danger is following us home. It's being brought home to our families. We have some providers that are sleeping in their cars, staying in hotels.
I have not hugged my daughter since this began. She said to me at the onset, "Mom, I've got asthma, and if I catch this, this is going to kill me."
They are often watching their colleagues get sick. The New York City Paramedics Union especially hard hit.
We have 2 members who are intubated. We have about 7 or 8 members who are in the ICU.
Michigan EMT Kayla Kapler's partner is in the hospital.
It's a different level of stress knowing that someone that you work with every single day is now fighting for their lives.
It's taking a huge toll, but we're getting through. And we will still be here. We will always keep coming back.
The sirens, the sound of a crisis, and the strength of their commitment. Stephanie Gosk, NBC News, New York.
True soldiers in this battle. Meantime, in the search for solutions tonight, a remarkable update about a husband severely ill with coronavirus and his wife's desperate search for a plasma donor. Here's Kerry Sanders.
He's crying. Oh, baby, I see you.
Kevin Rathel's family calls it a miracle.
Baby, yes.
On life support, 7 days in a coma. Doctors feared the worst. His wife Stacy says at one point she lost that inexplicable connection married couples share.
I just almost collapsed and broke down crying. I said, in my gut, I don't feel him. He's not around.
What turned it around? Doctors at Orlando Health aren't sure, but say 4 days after administering plasma from a coronavirus survivor, the antibodies in that plasma may have turned the tables.
We're unsure that it works or it doesn't work. That's yet to be seen. It worked in this case, but it's not the magic bullet, and we can't guarantee that it works in everybody.
Finding plasma donor James Crocker, who had survived coronavirus, tested negative, and had a compatible blood type, was no small feat. The unlikely connection began on social media. Kevin is awake, and you may have saved his life.
It feels amazing to know that I may have been the difference between life or death.
The FDA has approved this plasma treatment in more than 300 patients.
Oh, my goodness. Hello.
Today, Kevin was taken off life support.
Wow. We're hearing your voice. That is amazing.
His family learning that this afternoon.
Yeah, well, you look better.
Love you so much.
I love you too, Dad.
Even a moment with the family dog, Oliver.
And this is the moment we've been waiting for. And he is really recovering.
Doctors say Kevin Rathel may be out of ICU as early as tomorrow. His remarkable recovery and the role plasma may have played is now part of a much larger study. Lester?
What an amazing story. Kerry, thanks for sharing that with us. Coming up, what the new normal might look like as the country starts to reopen. Back now, trying to imagine the new normal. What will our daily lives look like, and how might they change, perhaps for good, when the country reopens? Here's Miguel Almaguer.
In the nation's most populated state, there is no timeline on when crowds can return to beaches, Yosemite, or Hollywood. But California's governor is laying out a roadmap to reopening, where the immediate future looks nothing like the past.
It's also perhaps the most difficult and challenging phase of all.
When the state's 6 million school children eventually return to campus, they'll likely have to keep their social distance in hallways. Class sizes could be cut in half and lunchtime staggered. And don't expect scenes like these. Sporting events, concerts, and festivals are unlikely to resume until the governor says there's a coronavirus vaccine or herd immunity.
California is home to some of the most iconic sports franchises in the world. Professional soccer teams, basketball teams, baseball teams, and football teams have no idea when they'll take the field again.
When stay-at-home orders are lifted, the governor says to enter a restaurant, your temperature may be taken. The server could be wearing gloves and a mask. The state could also mandate fewer tables for more room.
It's going to be like going to have lunch in your doctor's office. It's just not going to feel natural.
With the fifth largest economy in the world, California's governor says the next 2 weeks will be an indicator of when the region can get back on track. And while there may be no light switch for returning to normal, tonight the Golden State is perhaps offering a ray of light. Miguel Almaguer, NBC News, Los Angeles.
All right, up next here tonight, grab the kids. We want to tell you about something special we've been working on. Stay with us. And finally tonight, this pandemic has been hard for all of us to cope with, certainly, but especially kids. And so tonight, we're launching NBC Nightly News Kids Edition, From My Home to Your Home, an online newscast meant to answer kids' questions about this crisis and how it's changing the world around them. Like this question from Tess in New Jersey.
Everyone keeps talking about flattening the curve. What is the curve?
We'll have that answer, and we'll also be telling inspiring stories of kids going the extra mile, like a 16-year-old student pilot helping to ferry supplies to hospitals in his home state. Nightly News Kids Edition is on the NBC News YouTube page, and we'll be posting more installments along the way. That's our broadcast for tonight. Thanks for watching. For now, I'm Lester Holt. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.